All right, I want to talk about the three things that physios are doing that are actually making their patients' pain worse. Number one is chasing pain. Just because someone has a painful neck or a painful low back or painful knee does not mean that that is the cause. The cause is typically someplace else. So if we've got low back pain and we have a client whose T-spine doesn't extend or rotate, or hips don't extend and rotate, guess where all those forces move into? The low back. Because essentially most injuries are a physics problem. Energy moves to the area of least resistance. If the back is moving like it's supposed to, but the spine above or the hips below aren't, all those forces end up accumulating in the back, causing low back pain. So as soon as you start mobilizing those areas above and below that aren't moving, back pain gets better. Number two, it's a loading problem. If we overload them too soon in an acute phase, we flare them up. If we underload them, then we're not creating enough of a signal to allow the body to change. So it's finding the right load for the right person to create the adaptation that we're looking for. And number three is ignoring the nervous system. The nervous system is constantly looking for threats. If it doesn't feel safe with a movement or a range of motion or an exercise, it's going to put the brakes on. If it doesn't like what we're doing from a manual perspective, or there's no change occurring or pain is worse, it doesn't like what we're doing. So respecting the nervous system and listening to it is a way to know if we're being effective with our treatment and exercise prescription. So let's stop treating symptoms and start treating systems. That's the AMT framework.